Good morning, you guys. It is Amanda and Barron with Kickin'Cancer Cares on KSLM Radio, 104.3 FM and 1220 AM. Our sponsor for this first half is Odd Moe's Pizza. So huge shout out to Mike. He's been absolutely phenomenal in supporting us. So you guys, if you are looking for an amazing pizza with fresh ingredients that is the best in Salem and Kaiser, go to Odd Moe's Pizza and get the veggie and potato poppers.
And now that we're in the fall season, it's a good time to get a pizza and enjoy it at home.
Don't even cook. Just have it delivered straight to you.
But for those that are watching on YouTube, we are not in the studio. And we're back a second time in Aspen Grove. So let's welcome our guests. You want to do this?
Hello, you guys. Yes, go ahead.
Well, Micheal and Melissa and Naomi. So why don't we start with Micheal? Introduce yourself.
Hi, my name is Micheal Cline. I'm with Aspen Pain Clinic and Air Medical, and we're here to talk to you today about hyperbaric chambers.
Yeah. And Melissa?
Yeah, I'm Melissa Johnson, and I'm one of the hyperbaric chamber technicians. So.
And Silver Falls.
Okay, so we're mentioning that.
Okay. Do the whole thing.
Yes,
everybody.
Yes, within the Aspen Grove is also Silver Falls Wellness, where I do colon hydrotherapy.
Yeah, and for those that missed that episode, we're going to talk about that in a second.
Awesome.
But you have another person with you. Can you introduce this person?
Hi, I'm Naomi Khan, and I'm a user of these services of the hyperbaric oxygen.
Nice.
Yeah.
And we're going to get a lot deeper into your story and how that all ties in together, but welcome to the show. Welcome to the show. We have been doing this 100 disease-fighting foods.
Yes.
And I'm pretty sure that Melissa and Micheal might have some comments on this one. Today's is, not where I thought it was, there it is, lemon water.
Oh, I love lemon water.
Isn't it great?
Yeah, it is.
So this is why it's a disease fighter. Lemon water takes all of these benefits that you get from plain water and adds the benefits of the immune system supporting vitamin C. The citric acid in lemons can actually break up small kidney stones.
Okay.
Awesome.
You and I talked about before the show. You got some thoughts on lemon water?
Yeah. Oh, well, the other thing that's interesting about lemons or lemon water is it is acidic, but once your body digests it, it metabolizes and it makes your body more alkaline, which we know is directly related to an inhospitable environment for cancer.
Which is our whole topic
Yes,
today.
yes.
Any thoughts on lemon water, Micheal?
You know, I'm not a big fan. I don't drink it.
Okay.
Really?
Cut him off. Cut him
I know.
off. All comments. That's okay.
Gotta be honest.
That's okay. Honesty's good. Well, the fun thing for the update, Amanda, is I went back and looked. When we were at this place before, we were actually in the next room over, and Casey was with us. That show, the total show, both halves of the show, is number 2. Of all of our YouTube shows, that's number 2 and 100 views for both halves together. Casey's half, where she told her story, is number 2 for that section.
Yeah.
At 62 views. But I went to Ashlie, who handles our YouTube stuff. It went there faster than any other episode.
Oh, that's
Go
cool.
Casey, if you're watching this.
So people loved hearing about the colon hydrotherapy machine, like seeing it, and I think that's the value of bringing our show live to places like this so they can actually see what we're talking about. But I think that Casey sharing her own personal story touched a lot of people because it went number 2 so fast.
Absolutely.
So,
It is a beautiful story.
and I don't know if you remember, but as she was telling her story, there was a moment that she was remembering, like almost being dead as they were in church, and she's a happy person, but I heard her voice crack.
Yeah.
Yeah.
You know, it had to be hard to remember that,
Yeah. Oh, absolutely.
but that was such a great
touching.
It
Yeah.
was.
Yeah.
Well, what I wanted to do today was talk a little bit. We've talked about this guy before. His name is Otto Warburg. I know that you guys are both familiar with who he is. For listeners who don't know who he is, I mean, he was a German scientist. He actually got his PhD before World War II started. He was nominated 47 times for the Nobel Peace Prize. But what makes it interesting is he had studied chemistry. He had a doctorate in chemistry in Berlin in 1906. He was actually in his early 20s when he got his doctorate.
Wow.
And if you think about the complexities of what was going on in Germany at that time period, his mother was Jewish, so he was of Jewish descent, and he was openly gay, walked through the streets of Berlin with his spouse, his husband, holding hands.
Yep.
Neither one of those were particularly popular amongst Hitler's world. Not a big fan of the Jews or the gays.
No.
But Hitler's mother had died from breast cancer. And Hitler was obsessed with finding a cure to cancer. So he created an oncology division inside the Third Reich. And he brought Otto Warburg into that, spared his life to be part of his oncology clinic to find a cure for cancer. And the unfortunate thing for us is that I believe Otto did find the cure, and we just have not paid attention. And by we, I don't mean this room. I mean that, general medical public. But where I need both of your help is I'm going to tell you what his theory was with a lot of words here that I don't really know what they all mean. So what Otto theorized, or his hypothesis, was that cancer growth is caused because tumor cells generate energy, and mainly by anaerobic breakdown of glucose. Okay? What exactly does that mean? Either one of you help me out with that. Anaerobic
without air.
Yeah.
Anaerobic.
Starvation of the cell.
Okay.
Oh, sorry. Say that again.
One more time, Michael.
Starvation of the cell is basically what it's doing.
So the anaerobic is not getting oxygen, and the breakdown of glucose, which is the sugar. Right? He goes on to say that cancer should be interpreted as a mitochondrial dysfunction.
Yeah.
That's
a big word.
That's a mouthful. Help me out, Melissa. What does this all mean? What does this all mean?
So the mitochondria, if you're looking at the cell, it's the part of the cell that it's like the powerhouse. It's where energy is created. ATP is what the mitochondria produces, which is used in every chemical reaction of the body, whether it's making cells or hormones or whatever. So if that has a dysfunction, that's going to affect every aspect of your being.
Okay.
Yeah.
So the mitochondria is critical to cells, and he basically says that cancer cells are dysfunction because they need to be oxygen rich and they need to be alkaline, but they're not.
High oxygen, high alkalinity.
Yeah. That's what good cells are.
Yeah.
But
Yes.
cancer cells are low in oxygen and are acidic. Diseased. All right. So then the question in my mind is, if that's what he theorized, and that's what he began proving in the 1930s, then why haven't we spent the last 90 years figuring out how do we get more oxygen into our bodies? How do we get our bodies back to an alkaline state? We've had a guest on before who has a Kangen water machine that helps you become more alkaline.
Yeah.
Okay? And I've got a book that talks about diet to get more alkaline. But we're here for the other reason. How do you get your body more oxygen rich? And there's a contraption behind it that might help with that. So, Michael, how do we get our bodies more oxygen rich?
Okay.
I'm not alkaline rich. I'm sorry, oxygen rich.
Okay, so there's many ways you can do it without even the hyperbaric. You can simply do breathing exercises. You can get an oxygenator, put yourself on oxygen while you sleep. There's many different ways, but the most efficient, effective way, and by the way, this technology is nothing new. This is over 300 years of technology. It's older than the United States.
Hyperbaric oxygen, HBO therapy, is a medical treatment prescribed by a doctor to enhance the body's ability to heal. During hyperbaric oxygen therapy, you breathe 100% pure oxygen while inside a pressurized chamber. The pressure inside a hyperbaric oxygen chamber is about 2.5 times greater than the pressure outside the chamber. This high-pressure environment helps your blood carry more oxygen to all parts of your body. The increase in oxygen also helps your white blood cells fight infection. Before starting treatment, your doctor will thoroughly review all possible side effects. The good news is, most patients experience no side effects from HBO therapy. A specially trained HBO technician remains with you during the entire treatment and is available to answer any questions you may have. Once the doors to the hyperbaric chamber are closed, you will hear the oxygen begin to circulate as the pressure gradually increases. This is called compression. You may feel a fullness or popping sensation in your ears, just like flying in a plane. or driving in the mountains. This is due to the increasing pressure inside the chamber. But don't worry, the technician will let you know how to relieve this sensation. Your session will last around 2 hours. During this time, you may listen to music, watch television, or even sleep. Near the end of a session, the technician will gradually start decreasing the pressure inside the chamber. This is called decompression. This allows your body to return to normal pressure outside the chamber. HBO therapy is an outpatient procedure that is provided usually once daily for approximately 6 weeks. For HBO therapy to be effective, it must be provided 5 days a week. Hyperbaric oxygen therapy is much like antibiotic treatment because it only works when taken regularly for the time prescribed by your physician. We understand that coming to the HBO unit every day is a commitment. However, to obtain the greatest benefit from hyperbaric oxygen therapy, you should not skip a day unless your doctor tells you it is okay. Following your doctor's instructions is the most important thing you can do to help you heal.
Wow.
Developed in France. Right? France?
Yeah.
And so from there, just lost my train of thought.
Somewhere in France. Somewhere in France.
It's been
It's
around.
old.
It's old. It's
Yeah.
okay. Yeah.
So, yeah, the big...
You and I are on the same train. We're all good.
Oh, man. Some kind squirrel?
There you go. That's it.
Okay, so basically what these machines do is they create pressure and high amounts of oxygen, or purified oxygen. And what that does is simply the high amount of oxygen, it feeds the cells, feeds the mitochondria, and gets everything more efficient. It actually oxidates the cell, not cleans it up, and that makes it more efficient for nutrients and everything to go in.
Okay.
Can I explain one thing
Please,
too?
go.
So usually when we breathe, the oxygen is carried in the red blood cells, which have mass. But when your body's put under pressure, the oxygen infuses into the plasma, which is the liquid portion of the blood, which can get everywhere in through all the tissue. Because usually the oxygen would be bottlenecking if it's trying to get to, if there's a wound or if the vessels are weak. So when it's infused into the plasma, it can penetrate 5 times deeper into the body. So it has a lot more to do with the pressure. It's an added benefit that we're adding enriched oxygen at the same time.
Okay.
Is there can any age go into that?
Absolutely.
Okay.
Yeah, with infants, you just have to be able to clear your ears. And so, mamas might bring in an infant and they'd be nursing to help that happen.
Yeah.
But yeah, even with this smaller one, you can have 2 people in at the same time.
Even a woman in vitro having a baby inside of you, they can go inside the chamber
Okay.
as long as it's necessary for it. Obviously, I'm not going to put anybody at risk that doesn't need to be at risk, but there's really 0 to no risk to go into these chambers at all.
That's amazing.
Yeah.
So one of the first images that's coming to my head is I can see documentaries of these athletes, these high-level athletes, and they're on a treadmill, and they actually have an oxygen machine hooked up to them as they're running on the machine. Are they trying to get more oxygen into their system while they're exercising?
Yeah, they do that for recovery and for buildup. But they also do a deprivation of oxygen to strain the body. It gets also the cells to react and also become stronger also.
Michael, you're talking about, like, anyone can come in, women that are pregnant, and it sounds like a pretty safe environment. The other thing that we were talking about was these athletes that have them, and I think you said that they're good for recovery, build-up. What does all that mean?
Okay, so when it comes to recovery, so there's many conditions that this chamber can. There's probably over 100. I can't give you an exact number. 100 different conditions that it'll treat. So inflammation is one of them.
Okay.
Inflammation is a kind of a nasty thing. We need it, but too much of it is too much.
Right.
It creates damage to the body. So these chambers here can help reduce that, just with simple oxygen and pressure.
Gotcha. Well, the one thing we talked about before the show started was, and I wrote up some notes here myself, you said there's soft versus hard when you're oxygen rich. What does that even mean, soft versus hard?
Do you want to explain the differences?
Yeah, the hard chamber, soft chamber. So there's 2 types of chambers. There's normally with steel hard chambers, and those go up to higher pressures. The higher pressure you can go up to 4 or 5 atmospheres. these chambers right here are soft chambers, and these chambers go to about 1.4. 1.3 and lower is not even considered HBOT. It's just considered like air
Okay.
and a little bit of pressure. Anything over 1.3 is considered HBOT.
Okay.
So it's real medicine at that point.
What's HBOT mean?
HBOT means hyperbaric therapy.
Okay.
And so the hard chambers can go higher. Atmosphere mean a deeper dive to it.
Okay.
And so what that does is you can get deeper into the tissue with that. So she was talking earlier about the different things you can do with the pressures. So the higher pressures are going to be more visceral, like bone death, gangrene, ulcerations, those kind of things.
Okay.
And I would say, like, for cancer, though, they're talking, the pressures don't have to be that high at all. They're talking more in the realm of, like, I would say, like 2.1, 2.5 atmospheres. And even 1.5. They're doing a lot more on the soft shells, saying they're more actually becoming more effective. And the simple reason is doesn't create as much oxidative stress. Okay. So they're able to endure it.
Okay. You got some thoughts there, Melissa?
No, I thought I did, and then he answered them.
Oh, he answered your
He did.
thoughts.
He answered
I got
them.
there slowly.
Yeah.
Okay. Well, there's another book, and I think this is actually relatively new. I haven't brought this one in a whole lot, but I love the title of this book. It's called Killing Cancer, Not People.
Mm-hmm.
Such a great title for a book. There's a whole chapter here called The Cancer Diet, Oxygen Rich, and Alkaline. And most of this chapter is really on the alkaline side. How do you get your diet to be alkaline? But there's a spot in here that I thought was really intriguing with some of what you're talking about. The guy, his name is Colin Campbell, and he has a PhD, and he did a study. It's called the China Study. Are you even familiar?
I've never heard of it.
I haven't either. I'll have to do some digging to find what it is.
I will
But
look into it.
what he says is food. Hold on. Old age. Need glasses. As a man is laughing, you know.
I'm laughing with you.
You're laughing with you. Thank you. Food as a key to health represents a powerful challenge to conventional medicine. Okay, Food as a key to health represents a challenge to conventional medicine, which is fundamentally built on drugs and surgery.
Yeah.
The widespread communities of nutritional professionals, which you guys fall within that realm, researchers and doctors are as a whole either unaware of this evidence or reluctant to share it. Because of their feelings, Americans are being cheated out of information that could save their lives. I would say not talking about this machine, they're being cheated out of information that could save their lives.
Yeah.
Right?
Yeah.
I mean, if it's been around for 300 years,
You should know about it then.
and the first I knew about it was when I met you guys just a month or two ago.
Yeah.
Yeah.
But 300 years, they're being cheated
That's
out of
crazy.
information. Right?
Absolutely. Yeah.
2005 is when it started to, the Mayo Clinic, who started to work on it more and more. I forgot the doctor's name, amazing guy. And now it's just exploded. It's being developed more over in Israel and yeah.
Well, I want to get more, we've got a little bit of time left. I want to get more into this doctor from Israel in the second half, but a couple of more things in the book. It says, the problem today in America and the rest of the industrialized world is that we are loaded with the basic food groups. We have loaded the basic food groups with artificial sweeteners, trans fats, synthetic additives, and preservatives, hormones, and dyes, and the list goes on and on.
So not only is there no nutrition to feed the cells, so they're vital, but it's a bunch of toxicity that your body can't even use.
Yeah, and what was that phrase you said a little bit? The mitochondrial.
The mitochondrial dysfunction.
All of this stuff is probably contributing to that, right?
Yeah, absolutely. There are certain foods. Once again, if we're looking at food as a cure, there are certain foods that do feed the mitochondria. I wish I knew exactly which ones.
Well, this book goes into a lot of them that do feed the mitochondria.
Yeah.
I mean, that's the whole purpose for this one chapter alone, is how to get that kind of a diet.
Yeah.
This next part, I think that, I know that I've had a conversation with Micheal, I know that he'll like. He said the major cause, the majority of cancer is caused by what we eat and drink. You can dispute that if you like, but the evidence is in and irrefutable, and you simply won't win that argument. We are not intentionally trying to offend anyone when I tell you the following truth. We have arguably become a nation of fat, lazy, unhealthy people. Let's just say the way it is, right?
Yeah.
And in no uncertain terms, we are literally supersizing ourselves out of existence.
Only nation in the world that has obesity as a disease.
Yeah.
Really?
Yeah.
That's crazy.
Yeah, we
We're
are.
the only nation
Wow.
to consider it a disease.
Wow.
Yeah. And we are now the most overweight and malnourished nation in the world. Now,
That's too bad.
that's an interesting combination of phrases, right?
Yeah.
We're overweight and we're malnourished.
Mm-hmm.
You know,
Oh, wow.
we eat stuff that has no nutritional value,
No value.
and it causes mitochondrial dysfunction. You know?
Yeah.
So it's just really
And
crazy.
that supports all this. You can get into a chamber like this and you can get better and everything else, but if you're not doing things to change everything, your food, your diet, your life, everything else, this is just, it's going to help, but it's not going to get the results you're looking for. So you're right, big changes have to happen.
So out of curiosity, someone can come in here and buy an hour or 2 hours or 5 hours of time in here, and this is a loaded question because I think I'll get an answer, but do you just say, here, sit in the seat for an hour and leave, or do you actually teach them how to make those changes?
Actually, when a patient comes in and does it, I start sending them YouTube videos. I start sending them. I'm all about education. Education's huge because they can go in here and try it and be, ooh, that's really cool. But if they don't understand exactly what it's going to do for them, then it's useless. So no, the whole thing is preemptive to I want to overly educate anybody that's even thinking about this before they even get into it. And then we can start discussing what their needs are. And then from there, we can also develop how many times they need to go in. So like 20 visits in is when vasogenesis or neuroplasty or neurogenesis also occurs after 20
You're going to
hours.
have to back up for a sec because I don't know what that
Sorry.
means. That's okay.
So
Neuro what again?
neurogenesis and vasogenesis or angiogenesis. It's where a magical thing happens after 20 hours of being in an HBOT. Your veins and your vascular system actually starts to grow more, and your neural network actually starts to grow. Nothing else does that except your own body. It regenerates things like that. But as we get older, as you notice, we lose less and less.
Right.
So that's less nutrients getting out to what we need it to be. So that's what this machine is also in addition to it.
Interesting.
And so we can even help with TBIs. We can help with a lot of different things. So not just vascular, not just cancer, but for the plethora of other stuff.
Yeah.
And it's pretty awesome on our end because it really is close to 18 to 20 sessions when angiogenesis happens. So people see results before. Some don't see a whole lot, and they get a little discouraged. And then right around 18 or 20, they're huge shifts. So
Right.
it's neat to watch.
It is between 18 and 25. I mean, everybody's a little different, and I don't know if it's size or what it is, but yeah. And in the beginning, everybody gives that, oh wow, and then right in the middle, everybody comes like, and then right around like 20 plus, that's when people are like, oh my gosh, I feel it now.
Yeah.
It's incredible to watch.
I'll bet. I'll bet. Well, I know in the second half, because you kind of described how this thing worked, do you have some more questions on how this thing's working there, Amanda?
Well, I'm just thinking I've got a little football player, and he's starting to struggle with conditioning, and I'm wondering if something like this would help him.
Yeah. I mean, we want to get clearance and everything like that,
Right.
but yes, absolutely.
That's what's going through
Yeah.
my head. Just even simple things like that for my athlete,
Yep.
Just
No,
giving-
and we do see a lot of, we've seen everything from bodybuilders to everything. Yeah.
Okay,
Yeah.
so it's
For
not out of
repair.
the usual.
No.
No, I mean, if you go up for just this specific brand name, LeBron comes up all the time. All over
Okay.
the place. He has one of these in his own home. Exact same model.
Okay.
There you go.
Yep.
Highly endorsed.
Yeah, highly.
and I would say every sports and athlete, they have one of these in their home.
Well, and you think about, everything you're describing about how the cells need to be functioning at that high level of athletes, they're really working themselves at a high level.
Yeah.
And nutrition is huge. I have a friend who at one time was actually the nutritionist for the Trailblazers, and their job was literally, you're flying from LA, Chicago, so now you're talking about time zone differences and plane and what food should you eat so you're ready for the next game.
Yeah.
How do you get the oxygen in so you're ready? If you're going from Denver to LA,
Yeah.
you got oxygen levels. This is huge for those guys.
The other thing I wanted to touch upon also is, when you're working with a doctor with this, it's really awesome because they can also implement protocols that complement this.
Okay.
So for like cancer, they can go high dose vitamin C right after a treatment, and then boom, high dose vitamin C. And there's other supplements that they can do that really have helped. Probably Naomi's can chime in way more on me on that. But
Well, we're going to give Naomi a chance right after the commercial.
I had put that in there. I didn't want to forget it.
Yeah, no, nice way to lead us into the commercial.
Okay, I'm going to do a huge shout out to Odd Mo's Pizza. Thank you, Mike, so much for sponsoring us. You guys, just stay home and stay cozy on this Saturday and call Odd Mo's Pizza and order you a Reggie Veggie and some potato poppers. And they've got those amazing donut things.
Oh, yeah.
Those are super good too. And so thank you, Mike. And we'll be right back after these messages.